Today we're going to discuss about side effects of counseling. This is the part 2 video. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. This is the follow-up video to address certain doubts, concerns, and comments from the previous video. I will try my best to provide explanation, clarity, try to clarify certain misunderstanding, and also to ensure the better understanding of the topic. I'll do my best. First, let's have a clarity on this YouTube channel. This is a YouTube channel run by me, named as Suresh Badadmat. I've done 555 video, and this is the 556th video. And this YouTube channel is run by me alone, and it does not have any affiliation towards the institute where I'm working or many other organization I'm working with them, or maybe with various NGOs. It is my personal opinion. And if you look at the first 30 to 40 seconds of my every video, there are disclaimer which have clearly mentioned. That means this YouTube channel belongs to Dr. Suresh Badadmat. So, as you know that there are so many videos I have been doing for educating the healthcare professionals. You can also subscribe if you are not subscribed, and go through all the videos, and please do give constructive criticism and help me to make it better so that I can reach many students. Now, the first question was asked by many, what was the need of the video? Many of them even attack, telling that it's a malified intention. You are a psychiatrist. You are trying to damage many other profession. So let's understand why I did this video. First, we need to understand about the Mental Health Care Act 2017. If you look at the preamble is very clear. What does it say? It says two important things. One is to provide mental health care and services, and to protect and promote and fulfill the rights of the patients when providing services. So here we need to protect the rights. So what does it mean with this video? There are many students, counselors, psychiatrists, psychologists, nurses, social workers providing counseling. The reason being is the topic is very specific to make aware of the healthcare professional about this topic. I've done many videos on CBT. It is more than 12 videos. If you look at the DBT videos, again, more than 10 videos. And if you look at the counseling videos, there are more than 25. And with regard to telecounseling, many videos are there. I've talked about the efficacy of even DBT, CBT. You can check those in my channel, and I've given the various QR code. You can scan it. And also please do comment on those videos. So my intention was specifically to educate our healthcare professionals and also uphold the rights of persons with mental illness. Another commonest comment was, by releasing this video, you have increased the stigma and discrimination against persons with mental illness. And there was many comments personally on me rather than on the topic. Let's look at the evidence. One of the articles I even have quoted in the video 1. Here, the effects of talking about side effects versus not talking about side effects on the therapeutic alliance. Here, it was published in 2023 in Acta Psychiatrica Scandinavica. So if you go through this article, it's very clear. Monitoring and discussion of side effects does not worsen therapeutic alliance, but it can even improve the therapist and patient cooperation. So in this regard, discussing side effects, adverse effect, and negative effect of any intervention increases trust, transparency, faith in the treatment. And it is the right of every person to know what is the intervention, what are the risks involved. Suppose if I am discussing about side effects of clozapine, do you think I'm increasing the stigma, discrimination? or most of the doctors do discuss about the side effects. So by discussing side effects, nobody is increasing stigma or discrimination. Actually, it increases transparency and trust, my dear friends. So the next comment, why the comment section was disabled for this YouTube video specifically. So actually the discussion was supposed to be on the topic, and many mental health professionals started making comments on other professionals. Somebody said that psychiatrists are very bad, psychiatrists are giving medicine, they are not discussing about side effects. And this fight was becoming between mental health professionals. It was becoming they versus us. Few of them even deviated from the topic, and one of them has even made a comment, psychiatrists should stop prescribing medicine and they're killing patients. So this kind of discussion was unwarranted. And few of them even made a personal attack on me, telling that look at his body language. He's Olympic kind of body language, Olympic champion body language. I took it positively. Thank you very much. But that kind of comments does not look good on the YouTube video, because many of them may be patients or even the students. Some of them used unparliamentary words. By creating anonymous account, I had deleted them. But finally, this discussion did not lead to constructive way of making it good. Of course, there were a couple of very good suggestions, have included them, and there was some edits done. But however, having social media and personal attacks by a mental health professionals on each other does not look good. That is the reason I had to disable the comments. Otherwise, I'm still open for discussion on emails, but invariably on social media, if there are patients and patients parties are saying it does not look good. Couple of them haven't clearly said that you are targeting specific profession. Let me be clear. Some, I did not want to take their name. They said you are attacking counselors profession. And one of them even said, if you are a clinical psychologist, you would have known what is the difficulty. So these kinds of words started coming up rather than discussing on the topic. Let me make it very clear. The topic was side effects of counseling or maybe psychotherapy. Counseling and psychotherapy is a service done by diverse background of profession. It can be doctors, it can be nurse, it can be psychologist, clinical psychologist, rehabilitation psychologist, social worker, medical social worker, clinical social worker, psychiatric social worker. There are many teachers doing it, paramedics, now currently behavioral counselors, even HRs, and many other trained professionals are doing counseling and psychotherapy. That video did not attack any profession. It specifically discussed about side effects of counseling. Hence, this video is applicable to everyone, whoever is doing counseling or psychotherapy. That means, let me explain clearly. There are counselors who are maybe licensed. Some of them may not be licensed or registered. That's the word I can say. Some of them are trained. Some of them are untrained. Let me discuss about the licensed and trained. They are specialists. Like some of them are child-related therapy they are doing. They are very specific. They are registered and licensed and they are trained in that area. But there are very few in number in the country. Now, if you look at the licensed, untrained, for example, all psychiatrists are trained. Many of them may not be trained in dealing with children. So there are only few again who are trained in both. So, but untrained is more, though maybe licensed. For example, there are many psychologists. They may be registered or licensed in various two legislations, but they may be not be trained in specific areas, maybe in geriatric, maybe in DBT or family therapy. There are maybe many who are trained but not licensed. For example, lay counselors. So they are also there. There may be There are many who are not licensed and untrained. So these, all of them are doing psychotherapy, and I was addressing a specific topic of side effects of psychotherapy. So it is applicable to everyone. And again, I'm repeating, please understand, this counseling and psychotherapy is done by diverse background of professionals. So considering that it is attack on specific professionals, no, it was never intended for that purpose. I have done 555 videos and there was no need for this. This was an important topic which need to be discussed. So let's understand who are these people who can be registered. So if you look at the National Medical Commission Act 2019, it talks about allopathy doctors. Nursing Council Act, there are many nurses who spend time with the patients and they are doing counseling. It may be regarding domestic violence, it can be regarding medications, it can be regarding family, and even psychiatric nurses have been doing counseling and their curriculum is included in that. Mental Health Care Act of 2017 talks about various mental health professionals and they have to be registered, and those are also doing counseling. Now, the Rehabilitation Council Act 1992, Section 13.2 talks about various other professionals. I'll be shortly discussing about that. AIMS Act, PGI Act, JIPMER Act, and Nuanced Act of 2012. These are the statute of the parliament, gives power for them to give degree and train many other professionals to undergo doing counseling or maybe psychotherapy if they are specifically mentioning in their degree certificate or maybe in their curriculum. The new legislation is National Commission for Allied and Healthcare Profession Act 2021. These are the statute under which people are registered, and because of their curriculum, they are allowed to practice or they can practice. If you look at the RCA Act 1992, which was amended in 2000, Section 13.2e clearly says any person being a doctor or a paramedic in the field of physical medicine, rehabilitation, orthopedics, ENT, ophthalmology, psychiatry can practice rehabilitation profession. So again, rehabilitation profession definition is there. I would request you to go and see that because this legislation allows many people to practice. Now, let's move into the newer legislation, National Commission for Allied and Healthcare Profession Act 2021. In this legislation, at the end, there is a schedule. In the schedule, 7th item number talks about community care, behavioral health science, and other professionals. So here we need to focus on behavioral health science and professionals, which registers many of the professionals. Let's look into this behavioral health science professionals. If I zoom in and you can see clearly, behavioral health science professionals. Here, behavioral health science professionals is a person who undertakes scientific study of emotions, behavior, and biology relating to a person's mental well-being and their ability to function in everyday's lives and their concept of self. Here, they talked about behavioral health and they are preferred over the term mental health because they said mental health is, the word mental causes stigma. Under this legislation, it talks about counselors, analysts, psychologists, educators, and support workers who provide counseling, therapy, mediation services to individuals, family groups, and communities in response to social and personal difficulties. So, my dear friends, this video was for all those people who are practicing psychotherapy or counseling, both trained, untrained, registered, unregistered. This video was never intended to attack any professionals. So if you are allied healthcare professional and you are not registered, there is a portal. So please scan this QR code and register there. And if you have any difficulty, there is a grievance portal under Ayushman Bharat and also helpline. Please do call them and ask about any clarification or any doubt. Some of them even started discussing about other professions. And I don't know who are these people, but again, how can a psychiatrist speak on counseling? Who is he to talk about psychotherapy? So these are the words started coming up in the discussion, which was again unintended by them. Most probably it's an emotional reaction for the topic, but I would like to clarify here. Let's look at the evolution of psychotherapy because you need to understand about the roots and the history. Then only we will come to know how it evolved and why we are at this point of stage. And mental health professionals do not work together. So if you look at this, Dr. Sigmund Freud was a neurologist and also a psychiatrist who pioneered in psychoanalysis and psychodynamic psychotherapy. The other commonly practiced is cognitive behavioral therapy. Aaron Beck is also a psychiatrist. Dr. Gerald Klerman is a psychiatrist. He is a co-founder of interpersonal therapy. Dr. Viktor Frankl, psychiatrist, logotherapy. Dr. Fritz Perls, the founder of Gestalt therapy. If you look at the Gerald Kaplan and Dr. Eric Lindman, played a crucial role in brief crisis intervention. Again, they are psychiatrists. Dr. Jacob Levy Monroe is a psychiatrist, founder of psychodrama and group psychotherapy. Dr. Joseph Wolfe is a psychiatrist, developed systematic desensitization. Dr. Milton Erickson, psychiatrist, founded American Society of Clinical Hypnosis. Dr. Elizabeth Kubler-Ross, Dr. Eric Lindman, Dr. John Bowlby, they are all psychiatrists, talked about grief therapy, contributed immensely. Again, regarding Inkblot, Herman Rorschach is a psychiatrist. If you look at family therapy, Dr. Salvador Minuchin is again a psychiatrist who talked about, and is considered as the father of structural family therapy. Millen model of systemic family therapy is again doctors, psychiatrists are involved. And again, Brownian family therapy again is a psychiatrist. If you look at the Indian roots, Dr. Girendra Shekhar Bose, who is considered as the father of psychoanalysis in India, is an MBBS doctor. He's not even a psychiatrist actually. Dr. Jashwant Singh Neki, a psychiatrist. And he talked about Ausar, a very important concept brought from the Sikh scriptures. And it's very essential to know about this. Dr. Shamsundar C, a psychiatrist who initiated psychotherapy in Niemann's for psychiatrists in 1978, and it got formally becoming a curriculum in 1983. Few of them attacked my credentials. Are you a trained counselor or a psychotherapist? How can you talk about this? My credentials are I have done my MD in psychiatry from Niemann's. I have done DNB in psychiatry. I have done 3 years of senior residency and more than 20 years as a faculty at Niemann's. I was a consultant in OCD clinic for 16 years, doing CBT, guiding students with regard to cognitive behavioral therapy. And I'm the co-investigator for the Telemanas team, one of the largest counselors in the country, actually in the world. And also I have been involved in training lay counselors since 22 years. So they are the gatekeepers, basically identifying, doing psychological first aid and referral they are doing. So I have been involved in psychotherapy and also as a counselor. That doesn't mean that I have been given free permit. So if you look at the NMC curriculum, that is National Medical Commission, clearly talks about having psychotherapy as a curriculum. Please scan this QR code, you will get the curriculum, what they have mentioned, and every psychiatrist should undergo training. Further, at Niemann's, as I mentioned, Dr. C. Shamsundar brought psychotherapy. There is a formal mandatory training of psychotherapy for psychiatry resident at Niemann's, which was started in 1978, but formally it became a curriculum in 1983. Every Tuesday, 1 hour supervisors discussion with the students for 3 years, 5 cases to be submitted, 1 complete cases has to be done. In OCD clinics, rigorous CBT training for psychiatry resident occurs, 1 month of behavioral therapy, 1 month of family therapy. So clearly, the psychiatrists are allowed to do psychotherapy and it is their part of the curriculum. So these are the credentials of mine. So if you have any doubt, in every video I have put my CV to know who I am. But again, in the social media, writing those and attacking does not look good. One of them even attacked, you have not made any side effects of medication. You are unfair. You are talking about side effects of counseling. Please scan this QR code. I have made specific videos on side effect like neuroleptic malignant syndrome, cytopenic syndrome, tardive dyskinesia. I have warned many of our psychiatric students telling that please discuss about this side effects. That means in this 555 videos, medication on side effects are there. I am trying to educate students and healthcare professionals. One of them even asked, how can you compare between counseling and medication? Because many of the examples, when I talked about adverse effect and side effects, it is easy to compare them. But one of the counselor said that it is redundant, and even they made certain comments which were nasty actually. But I would like to tell them, if you type in Google Scholar drugs versus psychotherapy, you will find so many articles. Even if you type psychopharmacology and psychotherapy, and even in PubMed, more than 1,000 citations are there. And many of the time, efficacy are compared between drugs and psychotherapy. Here, we were discussing about side effects of psychotherapy very clearly. So, the research usually compares for efficacy of drugs and psychotherapy. Similarly, side effects has to be compared. That is the way research moves forward. That's the reason I brought the discussion on comparing between drugs and psychotherapy. So, this is how the research progresses. And even a couple of them commented, how can one can equate boundary violation with side effects? Even I got a call from Australia, who is a psychotherapist, also discussed about this issue. I'm happy the call was there and discuss what are the issues. Let's look at the boundary violation. Here is the therapist and the client. There may be boundary violation or boundary crossing can happen. So it can be unethical because boundary violations are not allowed in any of the association. Boundary crossing to some extent may be considered. It can be malpractice. It can be considered as illegal if the patient has severe effect. So these are very clear from the therapist point of view and association. What happens to the patient? In psychodynamic psychotherapy, we foster transference, and the transference may go wrong. Then it will be considered as a side effect. And it can be considered as an adverse effect. We do not want any kind of boundary violation either from the therapist side or the patient's transference. Especially in CBT, it can be considered as an adverse effect, or else some of them consider it as a negative effects, and few of them say it is a malpractice reaction or the impact on the client. So currently the researchers have divided. Some of them call it as a negative effect, some of them call it as a side effect, adverse effects. But if you look at certain researchers, they are very clear. We need to assess this. Although it may be a process of psychotherapy, but it has to be assessed and to be documented. And one of them even said that it is illegal, unprofessional for making this video, and people should complain against me to the authorities. Yes, of course, if they believe that, yes, I have done wrong, you are free to complain, because I would like to clearly say that I'm trying to educate the healthcare professionals under the Mental Health Care Act of 2017 to clearly uphold the rights of persons with mental illness. They need to know what's happening with them. So that's the way it goes forward. And even somebody talked about RPWD Act, that is Right to Persons with Disability Act. Yes, of course, they have a right to know. Some of them said that counseling and psychotherapy, you have combined it. Yes, I deliberately combined counseling and psychotherapy. Of course, there are differences between counseling and psychotherapy. But here, considering the contemporary world, we need to discuss as one. The simple reason is, if you differentiate counseling and psychotherapy, people will utilize it telling that I do only counseling, so there are no side effects, or yes, I'm doing psychotherapy and they do counseling. So the client may not know what is happening. Many of them said there is unscientific, this is misleading, this is false, poorly informed, poorly researched. Many of them use these words. So in that regard, I would like to again appeal to the viewers, please specify which particular statement or aspects of the video you believe could have been misinterpreted or potential to be misinterpreted. Identify the specific point in the video, timing of the video, would help us to constructively discuss that, edit that video. In fact, there were only 2 people who made a constructive advice, or you may call it as a criticism. I have edited that part of the video. And again, they mentioned it was the tone of the video and also words used. So I have changed it. So let's be very clear. We are trying to work to educate many healthcare professionals here. It's nothing between against one profession to another profession. If you look at the majority of the people who are watching these videos are basically healthcare professionals. And even if the patients and the patient party says it doesn't look good on the social media, there were comments telling that there are no side effects, there are no adverse effects, there are no negative effects. In my 30 years of careers, I have not seen this. You are discussing this, delete this video, you need to tender apology. But anyhow, I would like to clarify on this. If there are no side effects, adverse effects, or negative effects, please come up with a white paper. Say that counseling and psychotherapy does not have any side effect, no adverse effect. It can be practiced by anybody. No need to regulate this. Anyone can do this. Again, if you discuss about this, there is one school of people who say it's just a talk therapy. It does not have side effects. Everyone should be allowed to practice and no need to regulate. If you belong to that school, please write to the government and say we don't want any regulation, let everybody in practice. No, there is another school who uphold the ethics and they say we need to regulate this. We need to document about side effects, adverse effect, and negative effect. So this is the need of the hour at this point of time. So based upon your school of thought, you can take the call. There were comments telling that you have done this video, there is no guidance. If you look at the last 10 minutes of the video, I have talked about structured assessment. Around 8 different structured assessment scales were discussed. And effect of discussing of side effect was also addressed, and what to be done also has been discussed. Now let's move to the last part of my presentation. This RANSAP, that is Royal Australian and New Zealand College of Psychiatrists, have taken a stand. The stand is psychotherapy has adverse effect. And if you want to read about this article, this is available online. Scan the QR code, download and read this. But one thing caught my attention. That is, which is there in the below. Let me zoom it. It says, face it, facing it, always facing it. That's the way to get through, face it. So we need to reflect on this, and all psychiatrists are called for to look into the side effects. Both it may be medication, also for psychotherapy. If you look at the British Psychological Society, When Therapy Causes Harm, this was published in 2008. And again, a study, Predictors and Impact of Psychotherapy Side Effects in Young Adults. This was published in Counseling and Psychotherapy 2020. Again, this is the publication from British Association of Counseling and Psychotherapy. Scan this QR code, read the article. This article calls for structured assessment, documentation, discussion with the client. This is the research which are accumulating at this point of time. We need to discuss about this. We cannot brush it under the carpet. One or the other day, somebody will go to the court discussing about the side effects. If you look at from Scotland, the University of Edinburgh talks about the adverse effect of psychological therapy. And again, this article was published in Clinical Psychology and Psychotherapy. If you would like to download this article, this is the QR code available online. It also talks about the therapist and psychotherapist's experience with regard to and what should be done in near future, how to go about this. To conclude, my dear friends, counseling and psychotherapy is effective. There is no doubt about that. But we need to talk about side effects. We have data regarding the efficacy, but the safety data we do not have. For example, again, I'm talking example, clozapine was very effective in 1972. They released into the market, but they found that severe side effect, it was withdrawn. That means safety data was not available. Similarly, here we need to collect the safety data. We need to do research in psychotherapy. We need to document of side effect. We need to regulate the profession. For this, I request to have a good intake session before you start psychotherapy or counseling. And after every session, you need to ask for feedback. How did you feel about the session? Is there anything which is concerning about you, about me? Again, those kind of feedback need to be asked so that we can grow as a psychotherapist. To last, counseling is not for everyone, and not everyone can do counseling. Thank you very much for your valuable time. Stay safe.